Okay, good morning. I am Carlos Del Rio. I'm the Hubert Professor and Chair of the Department of Global Health at the Rollins School of Public Health and Professor of Medicine at Emory University. And I'm Chair of this National Academy of Sciences Committee examining the integration of opioid and infectious disease prevention and treatment efforts in selected programs. I want to welcome our guests online and those of you who are able to join us in person today. The study is sponsored by the Office of HIV/AIDS and Infectious Disease Policy in the Office of the Assistant Secretary of Health in the Department of Health and Human Services. And we have the pleasure of having a guest from HHS with us today. I am joined by the committee members on the study as well as the National Academy staff, and I will ask them to introduce themselves shortly. But before we go further along, I want to note that this is an open and on-the-record session. Interested individuals have been invited to attend as observers via web conference. I would like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I will ask everyone today here to be extremely mindful of the facts that the committee has made no conclusions and that it would be a mistake for anyone to leave here thinking we have done otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the academies. In addition, committee members typically ask probing questions in these information gathering sessions. That may not be indicative of the person's views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee must then respond to the review with appropriate revisions that adequately satisfy the Academy's report review committee and the National Academy of Sciences president before it's considered an official Academy report. I would like to explain the format of our meeting today. We have asked representatives from a number of clinics and programs to join us today to discuss their experiences integrating opioid and infectious disease prevention and treatment services. I want to thank them ahead of time for joining us. We hope to hear from them about the process of integration, including factors that facilitate integration, as well as challenges that make integration difficult. The programs have been interviewed at least once already, and the committee would like to follow up with additional questions. At the end of the day, we will also hear from additional experts on the topic in a panel discussion. If any web attendee is interested in asking a question, please submit your questions to Andrew Merluzzi at amerluzzi@nas.edu. Please note that this meeting is being recorded and webcast. Now, I would like to ask the committee members to introduce themselves, giving their names and current affiliations. Brief bios of the committee members and speakers are available online and in the attendee packages. Dr. Holly Hogan, you want to start?
Hi, my name is Holly Hagan, and I'm a professor in the College of Global Public Health at New York University.
Hi, Dave Thomas. I'm the Director of Infectious Diseases at Johns Hopkins.
Jody Rich from Brown University.
Ellen Eaton. I'm an HIV clinician investigator and a fellow with the National Academy.
I'm Dr. Edwin Chapman. I'm a practicing physician in Washington, D.C. For 40 years, 20 years in opioid treatment.
Hi, I'm Sandy Springer, Associate Professor of Medicine at the Yale School of Medicine Section of Infectious Disease.
Good morning, I'm Hannah Cooper. I'm on faculty at the Rollins School of Public Health at Emory University.
Good morning, I'm Julie Baldwin. I'm at Northern Arizona University. I direct the Center for Health Equity Research.
Morning, I'm Rose Martinez. I direct the Board on Population Health, Public Health Practice here at the National Academies.
Andrew Merluzzi, also National Academy staff.
Thank you. We will begin today's discussion with the Greater Lawrence Family Health Centers who are here in person to talk to us. Now I would like to introduce our first program representative, Dr. Christopher Bosaitis, from the Greater Lawrence in Massachusetts. Dr. Bosaitis is a family physician and clinical director of their HIV and viral hepatitis programs and a core member of the Lawrence Family Medicine residency faculty. He's committed to implementing evidence-based approaches to reducing the burden of these diseases in the community and to providing holistic, compassionate care to individuals living with them. As such, he has played a key role in the development of and implementation of novel programs at Greater Lawrence, including their community-based syringe services program, their mobile buprenorphine program for individuals experiencing homelessness, the Inpatient HIV and Addiction Medicine Consult Service, and the HIV Viral Hepatitis Areas of Concentration, which prepares family medicine residents to join the shrinking HIV workforce. Chris, thank you for joining us. Can you provide us with a brief introduction to your philosophy and care model? We would like to prioritize an open discussion, so after that, we'll open for questions from the committee. We will have to end the discussion promptly at 9:30 to begin with the next program. So please go ahead.